Hi, my name is Ashanti Wilson. Here's my rubric for my head to toe. There's nothing written on it. Just gonna say that. I'm gonna wash my hands. So hi, my name is Ashanti Wilson.
Hi.
Today I'll be conducting your head to toe. If you can just state your name and your date of birth for me.
Briasia Purchase, 10/22, 2003.
Okay, perfect. And do you know what year it is right now?
2024.
Okay, and can you state where we currently are?
Saginaw, Michigan.
And who's the current president?
Joe Biden.
Okay, so I can tell that you're ANO times 3, so I feel comfortable moving forward with this assessment. Right now I'm just gonna ask you a few health history questions. Some may be uncomfortable, but anything that we say will stay in this room, okay?
Okay.
So do you have any family history at all of hypertension, cancers, any diseases that I should know about?
No.
And do you have any current diagnosis or any diseases that I should know?
No.
Okay, do you have any medications that you're taking currently?
No.
Okay, do you smoke or drink at all?
No.
No vaping, nicotine, cigarettes, nothing like that?
No.
Okay, and do you take any herbals or supplements or anything like that?
No.
Okay, any past surgeries or hospital stays that I should know about?
No.
Alright, so everything sounds good there. So next we're just going to move on with your vitals. I'm going to start with your blood pressure, okay?
Okay.
And do you have a preference of which arm I use?
No.
Alright, I'm just going to find the brachial pulse. And I'm going to put my diaphragm right there. Okay, I got 116/78. That is a normal range. We consider normal to be 120/80, so that's good.
Okay.
Next, I'm just going to look at your fingers. Right now, I'm just noting for any signs of clubbing. I'm going to check cap refill. That looks great. It's coming back less than 3 seconds, so I can tell that you're getting perfusion to your fingers.
Okay.
So right now, I'm just going to take your pulse for a minute, if that's okay.
Yes.
So I got a pulse of 74 and a respiration rate of 16, which is good. So right now I'm just gonna take your SpO2. Like I said, I checked earlier for clubbing and capillary refill, so I feel comfortable with taking your SpO2. Should get an accurate reading there. I'm gonna also take your temperature while that's going. Temperature is 98.4, which is in normal range. We consider a normal range to be 98.6, so that's in good standing. Your SpO2 is 98%. I would be concerned if it was lower than like 96 or 97. So that's good as well. All right, so moving on, I'm just gonna start with your head. Do you mind taking out your hair for me?
No.
So right now, I'm just inspecting for any like lumps or lesions. I don't notice anything. I don't see any abnormalities. And now I'm just gonna palpate. Is there any pain or tenderness when I touch?
No.
Okay. Everything feels good. I don't feel any lumps or masses. Since we're here, I'm just gonna feel your lymph nodes. If you don't mind, can you put your hair back up for me?
Give me a second.
Okay, perfect. So right now I'm feeling your occipital lymph node, which is non-palpable. Your postauricular lymph node, also non-palpable. Your preauricular lymph node, also non-palpable. Your submandibular, that's non-palpable. Your submental, also non-palpable. You want to feel your cervical chain, that's non-palpable. And can you just bring your shoulders in for me? Yep. And this is your supraclavicular lymph node, that's also non-palpable. And then since I'm here, I'm just gonna check for your skin turgor. Okay, so there's no tinting. If there was tinting, I would be concerned with dehydration, but there was no tinting present, so I'm not concerned. So right now, I'm just gonna look at your face for symmetry. Everything looks good. Skin looks good. Hair distribution is good. Everything is symmetrical. Lips look fine. Okay. Right now, I'm just gonna move on to your cranial nerves. We're gonna start with cranial nerve number 1, which involves your sense of smell. So I'm gonna have you close your eyes and you can tell me what you smell when I put it on your nose, okay?
Okay. Hand sanitizer.
Perfect, that is hand sanitizer. So I can tell that your cranial nerve number 1 is intact. Your cranial nerve would involve the Snelling chart, which would also be another test that we can do, but I don't have that right now, so we wouldn't do that. So I'm gonna move on to cranial nerves 3, 4, and 6, which has to do with your eyes. Before I start, do you have any contacts or glasses? Do you wear any contacts or glasses at
I
all?
wear contacts and glasses.
Do they give you any problems?
No.
Okay, and do you have any like blurred vision at all or anything like that?
No.
And can you tell me the last time you've been to the eye doctor?
August.
Any changes in vision since then?
No.
Okay. And do you have a sensitivity to light?
No.
Okay, perfect. So right now I'm just gonna shine the light in each one of your eyes and make sure that your pupils constrict. Okay. Perfect. Okay. So both pupils constrict, which is really good. Next, I'm gonna shine the light at the tip of your nose and make sure that the light hits both of your pupils at the same time equally. Okay. Just look at me. Perfect. Okay, that looks good. So the next assessment that we're going to conduct is the sixth physical gaze. So if you can just look at my pen light, and then I want you to follow my pen light with your eyes and with your eyes only. Don't move your head, okay? Okay, that was perfect. So I can tell that your eyes are pearly, which means your pupils are equal, reactive, round, and accommodation to light, which is good. So next, we're gonna move on to your cerebellar function.
Okay.
So I'm just gonna hold my pen light, and I want you to touch your nose, touch my pen light. Okay?
Okay.
Touch the pen light, touch your nose, touch my 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 pen light. Perfect. Okay, so now we're just gonna move on to another test. I'm gonna have you do an okay symbol for me, and then can you touch each one of your fingertips to your thumb, and then as fast as you can. Perfect, that looks great. All right, so the next test we're gonna do is we're gonna put our hands on our thighs, and then we're gonna flip them over, and then repeat that as fast as we can. Okay, perfect. So that looks good. So I can tell that your cerebellar function is intact. We're gonna move on to cranial nerve number 5. So if you can just open your mouth for me, and clench your jaw, and open, and clench. Perfect, that feels great. So I can tell that your cranial nerve 5 is intact. Now we're gonna move on to cranial nerve number 7. So can you smile for me? Frown. Can you puff out your cheeks? Can you up puff them? Can you raise your eyebrows up and raise them down? Perfect, that looks great. So your 8th cranial nerve would be for your hearing, but as right now I can tell with the conversations that we're having, that your hearing is great, but we'll also be doing the other part of cranial nerve towards the end. Okay, so now we're going to move on to cranial nerves 9, 10, and 12. So can you stick your tongue out for me? And can you move it side to side? And up and down? Okay, that's great. I can tell that cranial nerve 12 is intact. With cranial nerve 10, I can tell through like the talking that we've been doing that your mouth moves fine and everything like that. All right, so for 9, I'm just going to take a look in your mouth. Before I start, do you have any cavities at all?
No.
Okay, can you tell me the last time you went to the dentist?
June.
Okay. Can you open? Perfect. I don't see any signs of cavities or anything like that. And do you mind just lifting up your tongue for me? And can you pull your lip down? Perfect. So I'm just going to put this on your tongue, and I just want you to say ah, okay? Can you say ah?
Ah.
Perfect. So your uvula moves so I can see that you have a gag reflex. Everything looks great in there. So now I would check your ears with the otoscope, but we don't have that right now. So I'm just going to take a look in your ears with my pen light, if that's okay. Okay. Everything looks great in there. There's a little bit of earwax, but that's normal. Hair distribution looks good. I don't know any sign of polyps or anything, so that looks good. Moving on to your nose, have you ever had a deviated septum at all?
No.
No deviated septum? Okay. And do you have any like trouble with smell or anything?
No.
Okay. I'm just gonna take a look up there, okay? Okay. That looks great. Mucosa is moist and everything. Hair distribution looks good, and I don't know any signs of deviated septum, so I'm not concerned at all. I'm just gonna inspect your ears. I don't see any redness or anything. Is there any tenderness at all?
No.
Okay, perfect. And I'm just gonna test cranial nerve 11 by having you shrug your shoulders up and put them down, up and put them down. Perfect. Like I said, your face looks symmetrical. Your trachea looks like it's in line, so I don't have any concerns with that. So now if you're ready, can you turn your back the other way?
Yeah.
Do you mind if I untie your gown for you?
No.
So just from examining your back, everything looks good. Just a few freckles, moles, hair distribution looks good.
Can I stand over here, Billy?
Yeah, temperature looks great. Your spine looks like it's in line. Did you have any scoliosis or anything like that when you were younger?
No.
Okay, perfect. Like I said, that everything back there looks great. So right now, if you don't mind, I'm just gonna feel on your throat a little bit. Okay. So right here, I'm just gonna displace, and I want you to swallow for me, okay?
Okay.
And you swallow. Alright, I'm gonna do the other side, displace, and can you swallow? Thank you. Okay, that feels good. So next, I'm just gonna move on to your lung sounds. I'm gonna listen to 12 spots of your lungs.
Okay.
Before I do that, I'm just gonna check your lung expansion. So if you can just breathe in for me and breathe out. Deep breath. Perfect. Okay, so I can tell that your lungs are symmetrical, which is good. So like I said, right now here, we're just gonna take those 12 lung sounds. Halfway through, I'm gonna ask you if you need a break because it can be tiring, okay?
Okay.
Can you just bring your shoulders back for me? Perfect. Okay, you can let it go. Can you breathe in for me? And breathe out. Breathe in. Breathe out. Perfect. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in again. Breathe out. In again. Perfect. We're halfway through. Do you need to take a break at all?
No.
Okay. I'll have you do the same thing. Breathe in. Breathe out. Again. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, I'm just gonna go under your shirt a little bit, okay?
Okay.
Breathe in. Breathe out. And breathe in. And breathe out. Perfect. So your lung sounds are clear. That's good. So next we're just gonna move on to percussing. I'm gonna do those 12 same spots and I'm just gonna tap my finger and listen for resonance, okay?
Okay.
You okay?
Mhm.
Okay. Just gonna go under your shirt again, okay? Alright, so that sounds good. I did hear resonance, which is a good thing. So I'm gonna have you turn back towards me, please, if you don't mind. And then I'm just gonna feel for your carotid pulses, okay? We do these one at a time. So that one's nice and strong. I'm just gonna feel for the other. That one's nice and strong too. So now I'm just gonna listen with my bell for any signs of bruise, okay?
Okay.
Can you hold your breath for me? Alright, you can let it go. One more time. Hold your breath. Alright, you can let it go. I didn't know any signs of bruise, which is a good thing. So now we're just gonna move on. Can I have you lay down for me? And I'm just gonna take these pillows real quick from you. So right now, I'm just gonna inspect your neck and look for any signs of JVD, which is jugular vein distension. So can you turn your neck towards me? Perfect. And can you turn the other way? Okay, that looks great. I don't notice any signs of JVD. I'm gonna put these back for you. If I did know, do you want both of them or just one? Both is fine. Okay. You kind of high. There you go. If I did know any signs of JVD, I would try to raise my bed 45-degree angle. If that didn't help, I would be concerned with fluid overload, okay?
Okay.
All right. So now, if you don't mind, can I just pull this down just a little? Is that okay for you?
Yeah, that's
All right.
fine.
I'm just gonna inspect your chest. I do see just like a mole right here and there. It doesn't give you any problems, does it?
No.
Okay. Temperature feels great. So right now we're just gonna listen to your 5 heart sounds. That's gonna be your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. Okay? So right now I'm just gonna be listening. Like I said, 5 spots. First I'm gonna listen with my diaphragm for love dub, and then with my bell to see if I hear any murmurs, okay?
Okay.
For this, can you get a little bit closer? All right. So first we're gonna start at clavicle, space, rib 1, space, rib 2, space. Here's your aortic. I'm gonna listen with my diaphragm. Perfect. I am hearing love dub. And now I'm just gonna switch over to my bell and listen for any signs of murmurs. Okay. I'm not noting any signs of murmurs, so now we're just gonna go over to the pulmonic side, okay? So this is your left side. We're gonna start at clavicle, space, rib 1, space, rib 2, space. And I'm flip back over with my diaphragm. We're gonna be listening to love dub again. Okay. I am hearing love dub, so now we're gonna switch over with our bell. Listen to any signs of murmurs. Okay. I don't know any signs of murmurs, so now we're gonna go down to your Erb's point. So we're gonna finish at that, and we're gonna go down to rib 3, space. This is your third intercostal space, and we're gonna listen right here for love dub. Okay. I am noting love dub, so now I'm gonna switch my bell over and listen to any signs of murmurs. Okay, perfect. If you don't mind, I'm just gonna go under your shirt just a little. So rib 4 and space. This is your tricuspid. Okay, I am noting love dub, and I'm gonna switch over to my bell and listen for any signs of murmurs. Okay, no signs of murmurs. So now we're gonna go to the mitral, rib 5, space, and we're gonna go over mid-clavicular. I'm gonna switch back over to my diaphragm. Hold on. There we go. Okay, I am hearing love dub, and I'm just gonna switch over to my bell one more time and listen for any signs of murmurs. No signs of murmurs. So now right here, I'm just gonna take your apical pulse. This is the most accurate pulse, and like I said, we're gonna do this for a minute, okay?
Okay.
Okay. I got 68 beats, which is kind of close to what I got for your pulse, which is really good, okay? So now we're gonna move down to your abdomen. So if you don't mind, you mind if I pull this down some more?
No.
Okay. So right here, I'm just gonna inspect for any distension. No, I don't see anything, any lumps or masses at all. I'm just gonna go down. Can you uncross your legs for me? I'm gonna go down to the foot of the bed, and I can see your aorta pulsing, which is good. That's normal. Everything looks good there. Do you have any problems with your stomach at all? Any tenderness or anything?
No.
All right, so right now I'm just gonna listen to the 4 quadrants. I'm gonna start with the right lower and move over to the other side with your right upper, your left upper and left lower as well. I'm just listening to 3 to 5 bowel sounds, which are like the gurgles in your stomach, with my diaphragm, okay?
Okay.
So we're gonna start on your right. We're gonna start on your right lower quadrant. Bowel sounds are present. We're going to move up to your right upper quadrant. And bowel sounds are present. We're going to move over to your left upper quadrant. Okay, bowel sounds are present, and then your left lower quadrant. And bowel sounds are present there too. So next, I'm going to be listening to 5 arteries on your abdomen as well. I'm going to listen to your atrial, your 2 renals, and your iliacs, okay?
Okay.
So to find that, I'm going to start from your xiphoid process to the tip of your belly button, meet right in the center. We'll redo that. Okay, about right here, and I'm going to listen to any signs for bruise, okay?
Okay.
I don't hear any bruise, so now I'm going to move over to your right renal. Not noting any sign of bruise, so now I'm going to move over to your left renal. Also not noting any signs of bruise, I'm going to move over to your left iliac. Not noting any signs of bruise, and then your right iliac. Also not noting any signs of bruise, which is good, okay?
Okay.
So right now I'm going to percuss in those same 4 quadrants that we did earlier, starting with the right lower quadrant, moving over to the rest of the quadrants, okay?
Okay.
And right now I'm just listening for timpani, okay?
Okay.
All right, that sounds good. So now I'm just gonna be percussing all the way up till I get to your liver border. And I'm listening for timpani until it gets dull. Once it reaches dull, that's how I know I found your liver border, okay?
Okay.
All right, I would say your liver border is right here. If it was any lower, I'd be concerned about your liver being enlarged, but since it's right there, I feel like that's a good spot, okay? So right now, after, we're gonna be doing some light palpations and deep palpations. If there's any tenderness or pain, just let me know, okay?
Okay.
So we're just gonna start with some light palpations, if that's okay with you.
That's fine.
Okay. And do you feel any pain or tenderness at all?
No.
And you did say you had about like a good diet. You try to stick to a heart healthy diet.
Yeah.
Okay. I don't feel anything. So now we're just gonna go a little bit deeper, okay?
Okay.
Any pain or tenderness where I'm touching?
No.
No. And I see you have a belly button piercing. Does that give you any problems at all?
Mm-hmm.
Okay. Perfect. We can pull those back up. So now I'm just going to move back to your legs. Do you want your gown back on?
Yeah.
Okay. Now I'm just going to lift this up, okay?
Okay.
So right now I'm just feeling for muscle tone. Temperature feels good. Legs are a little cool, but it is kind of cool in the room. Same as your feet, they're a little cool, but it is kind of cold in the room, okay?
Mm-hmm.
So right now I'm just looking at your toes. I'm going to test for capillary refill, okay?
Okay.
Perfect. Those come back in 3 seconds. I'm just going to inspect if you don't mind. Okay, yeah, I don't see any signs of edema or anything like that. Do you have any tingling or numbing sensation in your legs at all?
Mm-mm.
Perfect. All right, so now I'm just going to take your pulses. I'm going to start with your popliteal. Can you raise your knees up for me? Perfect. And I'm going to do your posterior tibialis. Okay, I can feel those as well. And then your dorsal pedis. Okay, and I can feel those as well. I'm going to do your femoral pulse too. This can be uncomfortable. But yeah. Is it okay if I kind of go in your shorts? Is that okay?
Yeah, that's fine.
Okay. Can you raise your leg up for me just for a little? Okay. And then can you raise the other one as well? Perfect. Those are strong and symmetrical. So now I'm just going to be listening with my bell again for any signs of bruise, okay? Sorry.
Yeah, okay.
Right here in her shorts, not noting any signs of bruise. I'm just going to move over to this one. Can you raise this leg for me? And I'm right here. Okay, I can feel it. Also, again, noting those signs of bruise. All right, you can put your legs back down for me. Okay, so right now we're going to do a sensation test.
Okay.
So we're just going to be doing dull and sharp. I'm going to have you close your eyes and you can tell me if it's dull or sharp and where it is on your body, okay?
Okay.
We're going to do a practice and I'm just going to show you what dull is and what sharp is, okay?
Okay.
So this is dull. Can you feel that?
Yeah.
All right. And then this is sharp.
Okay.
Can you tell the difference?
Yes.
Okay, perfect. All right. We're going to start. You ready?
Mm-hmm.
Okay.
Dull right thigh.
Okay.
Sharp left thigh.
Perfect.
Dull right shin.
Perfect.
Sharp left shin.
Okay.
Dull right top of the foot. Dull left top of the foot.
Perfect.
Dull left bottom of the foot.
Okay.
Dull right bottom of the foot.
Okay, perfect. So you got an 8 out of 8 on that. That's perfect. A normal passing score would be 6 out of 8, but you got an 8 out of 8. So there's no any concerns with like feeling or sensation.
Okay.
All right. So if you can turn back towards me. And are you feeling dizzy at all?
No.
Okay. So right now, if you don't mind, can you put back your arms for me? I'm just gonna check symmetry of your radial and brachial pulses. Okay. So we're gonna start with the radial. Perfect. They're strong and symmetrical, and your brachials. Those both are strong and symmetrical too. Do you know how to swim?
Mhm.
Okay. Can you do a swimming motion for me?
Mhm.
Okay. A bit of cracking. Does it give you any pain or like tenderness at all?
No.
All right. And then can I have you do this with me? Okay, that feels great. And can you squeeze my hands? Perfect. And can you push them in? And then can you push them out? And then can you push them down? And can you push them up? Okay, that feels good. So your range of motion and strength feel great. Now we're just going to do the same thing with your legs, okay?
Okay.
So can you push them out? Perfect. And can you twist your ankles? That feels good. And can you push my hands out? And can you push them in? And can you push your feet down? And can you push them up? Perfect. So now I'm just going to be feeling for your patellar reflex.
Okay.
So if you can relax your legs. Perfect. Can you close your eyes? That's good. Sorry.
Okay.
That's great as well. Perfect. And you said you're not feeling any signs of dizziness or anything like that?
No.
Okay. So for the next test, I'm gonna have you put on your shoes. Are you okay? Do you want to wear some socks or anything like that?
No.
Okay.
Actually, yes, I do want to wear my socks.
Okay. And then if you want your gown back buttoned up, you can do that too. You want me to type it?
Yeah, please.
No problem.
Just that one is fine.
Yeah, you're all covered up. So right now, we're just going to do the Romberg test. This is testing your balance. So if I can have you put your feet shoulder width apart and then your arms out just a little bit for me. And then we're just going to stand here for 10 seconds with your eyes closed, okay? And can you put your head up just a little bit for me? There you go. Okay, perfect. I will just notice little to no swaying, which is good. So I will give you a negative Romberg test. So next we'll be testing your gait. We'll be walking from the wall back regularly.
Okay.
If that's okay with you. Okay, you can turn around. Okay, and now we're just going to be walking heel to toe, same way back to the wall and back that way. Okay. Perfect. Okay, that looks great. Can you sit down for me?
Yes.
All right, I'm just going to be touching your face one more time. Do you have any problem with sinuses at all?
No.
Okay. I'm just going to be feeling for your frontal and then your maxillary. Okay, so that feels good. So on a Braden scale, I'll give you a 23. I don't have any concerns with like excess moisture. You don't know any signs of friction and shear. Diet is good, and as far as mobility goes, it looks great as well.
Okay.
So like I said, I'll give you a scale of 23. Thank you for conducting this head to toe with me, and yeah.